For anybody who is sincere to him or herself, you would agree with me most appropriately that there is nothing as beautiful as passing the blame, the responsibility of what we are supposed to do to others. It is always very, very good when you are talking and you are saying how the political class have done so terribly, how they've stolen all the money, and how they've done nothing, towards making sure that what they promise the masses is what is being delivered. I want to go a bit off that lane now and talk about those professionals in the healthcare sector who are the main problems of the system. But then we love to put the blames on the government, on the patients, and on every other person who is available. Have you really noticed that there are institutions that no matter how excellent, how timely the government may get with funding those government-owned health institutions, that these institutions still are not able to offer optimum healthcare services to their patients? These are centers where this employee who are supposed to be the chief servants of these patients act as lords that ought to be worshipped and adored, at all costs, irrespective of the fact that why these patients are in these hospitals are so that you offer them service, which from the revenue gotten from the payments they make for these services are used to pay you, the staff. You are a staff of a hospital in a southeastern owned government hospital. You don't go to work. When you go to work, you don't try to discharge the best of your service to your patients. Then you get to work, you don't sit at your desk to discharge that service. A patient comes to you making complaints and asking you questions about what they should know from you. You get irritated, you're shouting at the person, you're screaming at the person. Are you no worse than a devil? Are you not the problem of our healthcare? I understand that the government needs to provide for us the best of infrastructure for us to thrive. They need to provide places where the staff will sleep when they are on call or when they're on night shifts. They need to provide food. They need to take care of the welfare of these staff who are going to be working in these hospitals. But when, for example, some of these governments make these provisions, do you really stay back to do your duty? Do you really check on that patient whom you are supposed to follow up every hour, every minute, to make sure that that drug that is being administered, to make sure that that care that you're supposed to give as a nurse, to make sure that that investigation you're supposed to do as a medical laboratory scientist, to make sure also that those modalities you're supposed to put the patient through as a radiographer are all done, all in the interest of these patients? I would plead with every one of us who, for any reason, has anything to do with working in a government-owned hospital with the state government or federal government, that you handle this as your own business. Enough of these excuses we give most times. Patients come to you, you're screaming at them, you are harassing those of them you can't verbally because you feel you are in charge. I feel this is a problem we need to look at and address. If the healthcare sector in the Southeast must work, we must have leaders in the health sector who wouldn't care whose ox is called, who would insist that for every duty you've been called to do, that you give it your very best. Enough of the excuses. At the end of the day, who suffers for each time these excuses are allowed? The patient. And that patient could be your brother, that patient could be your mother, that patient could be your friend, that patient could even be your girlfriend. I feel that it is high time we started engaging on things that matter. While we hold the political class accountable to do the needful, you, the staff, give your very best to this service God has called you to.